Hello, this is my presentation on Standard Operating Procedure Creation for course BML 489 Independent Capstone Project Seminar by Stephanie Peterson. In this presentation, I will discuss the executive summary, rationale, description of the project. I'll give the conclusion. I will explain my appendices. I will discuss the assessment of the project. I will provide my reflection, and I will share the references. The Medical College of Wisconsin is a medical school that partners and shares a complex with Frederick Memorial Lutheran Hospital. The Medical College of Wisconsin has an academic side, which works with the medical school and students, and a clinical side, which works with faculty who practice in the clinics and the hospital. Within the clinical side of the college is the Division of General Internal Medicine. This division is broken down into 3 sections: primary care clinic, which is all outpatient; perioperative medicine, which contains both outpatient clinics and inpatient services; and hospice medicine, which is all inpatient work. This division of the college is one of the largest on the clinical side, with over 200 providers and the largest group of administrative staff to support these providers. With such a large group to support, many of the administrative staff are asked to take on a significant amount of work and succeed in their duties. While the roles are similar, each section has different protocols and procedures. During planned vacations and leaves, employees can designate their job duties to other staff members of the same role, and even explain what needs to be done. However, when an employee goes out on leave unexpectedly or leaves the position, it becomes an issue to successfully complete tasks that are designated to that person. Due to this, I plan to implement a project that focuses on creating standard operating procedures, or SOPs, to help in these situations and to also use for training and onboarding new staff. Standard operating procedures will provide continuity in completing tasks and make sure all tasks are compliant with MCW policies and procedures. The scope of this project will focus on a group of employees called Clinical Program Coordinators. The core group of employees are mainly responsible for creating the work schedules for our providers and processing time off requests for them. Since rules differ from outpatient to inpatient, it is important that everyone knows how to adequately provide coverage while others are out of the office. Currently, the focus is only on clinical program coordinators and creating standard operating procedures for their job tasks. I'm the Program Coordinator 3 for the Hospice section in the Division of General Internal Medicine for the Department of Medicine at the Medical College of Wisconsin. My job consists of the need to complete accuracy to ensure the patient's safety is top priority. In doing so, I have numerous tasks that are like the other 2 coordinators in the division. One of the main job duties all 3 of us share is scheduling for our providers. We each must work with our providers to create a schedule that shows when they are working and where. Each of our schedules are complex, yet different. We have our own projects and other duties that are specific to each of us. It is important to provide consistency across all 3 positions and ensure that we are completing our tasks in a similar manner that decreases errors and ensures that we are all compliant with company policies. I believe that we can align our positions to ensure that if any of us need to help each other or coverage while out on vacation, we have a generalized location to find the information needed, and that we can all complete tasks correctly. I would discuss the appropriateness of this program. Employee turnover is a problem that every company faces, but our division has had a large turnover with our coordinators. We each must rely on our own knowledge to train new employees to join the team. As we know, onboarding is very costly to an organization. As new employees join the team, they are left to navigate on their own and learn the duties based on current employees training them, which is not the best practice, as each section is different. This can lead new employees to become frustrated while trying to learn, not only about the company, but also their job. In addition, vacation and last-minute emergency time off presents coworkers with the difficult task of trying to ensure that work is being completed in a timely and correct fashion. Employees are often spending more time trying to find out how to provide proper coverage for someone than the coverage itself. SOPs allow new employees to have the tools readily available to help navigate their daily duties and provide coworkers with the necessary tools to provide proper and adequate coverage in their absence. This helps to ensure that less errors occur and that duties are completed in compliance with company policy. Application reasoning. My section does not have a location where this information can be found. We expect different employees to spend their time training new employees different portions of the job that they are familiar with, which takes away from the productivity of other employees. Coworkers also waste time trying to figure out how to do certain tasks that are required in an employee's absence, which also affects productivity and wastes time. Creating SOPs that can be in shared area will decrease errors and ensure that productivity is not affected. As for activity for the future, after the clinical program coordinators complete their standard operating procedures, we must maintain these documents to always ensure accuracy. Documents should be checked regularly and updated as procedures change or tasks evolve to move steps. After standard operating procedures are completed for clinical program coordinators, the division should then move to other core groups of employees and implement these SOPs in their roles. Program managers should be the next step. Upon completion of that, we should ask our administrative assistants to begin their SOP creations, followed by the division administrator and business operations coordinator. When I started in this role, this was a brand new position and I was the only clinical program coordinator. I had to learn how to do this role with no guidance and minimal direction. In time, both perioperative medicine and primary care sections each promoted an admin assistant to clinical program coordinator and assigned similar tasks to what I was completing. There was not guidance or documents for any of us to use while not only learning to learn the role, but to adequately complete tasks in compliance with company standards. As tasks were being learned, I would create a document with simple instructions to use when completing these tasks until I became familiar with this role. As a brand new position, I created this. I was told what was expected of me and found ways to make sure everything was completed accurately. I am well versed in this role, but others in my section and division are not. As my position grew and more tasks were assigned to me, I was tasked in not only completing these duties, but learning them as well. The clinical program coordinators were then tasked with cross-covering each other. I had things jotted down so that I would understand how to do things, but not so other people knew. I would spend a lot of time prior to going on vacation, meeting with my coworkers and going over my job duties and what would be expected for coverage in my absence. This process seemed to work well, and tasks would get completed, but I would still receive emails and text messages asking specific questions that would come up while I was out. I didn't truly see the need for standard operating procedures until I was unexpectedly out of the office for an extended period of time. In 2018, I was out on personal leave for an issue with a family member. While I was out, I had received a few urgent emails from coworkers asking how to do certain things that were time sensitive. While no one wanted to disturb me during this difficult time, they had no choice. The work had to be done quickly and accurately to ensure that patient safety and our providers were being tended to. While I did not mind being bothered, others deal with things in different ways, making it important for us to have a process that would help others learn what they needed to do while others were out. The second occurrence that ultimately started the project was just recently when a coworker decided to not return from maternity leave and quit without proper notice. While we had knowledge of some of her tasks since we were covering her, we did not know the scope of her job duties, and we did not know things that needed to be completed past her maternity leave. We didn't have further guidance, documents, or notes, and found it extremely time-consuming to search through documents to try to find any information about what was due and when. Next, I will discuss the value in assessment. As I began researching proper standard operating procedures, I found significant reasons why standard operating procedures should be implemented in our division. I learned that SOPs could have several advantages in the workplace. For instance, if they are created early enough, they can be a powerful tool for finding and correcting operability issues. Standard operating procedures ensure that the knowledge we have in our business stays in our business, meaning people won't remain with the company forever. So it's important that all the information that each employee brings is retained within. Processes can also change over time. As we learn how to complete a task, we often follow discrete steps until we gain enough confidence and knowledge about the process. As we become familiar with these processes, we begin to cut corners and trim steps to accommodate our own style. Standard operating procedures are designed to ensure that tasks are completed correctly every time and ensure that all steps are followed accurately. Also, SOPs can be edited over time as we change our processes or we create new tasks. Standard operating procedures are also useful when training new employees. It isn't fair to have new employees come on and not have guidelines for them to follow. It is also important that new employees are trained correctly and accurately. While experience is useful in training new employees, you are at risk for current employees training the new employees in ways that they do things, while not always correctly. When new employees are not trained correctly in the beginning, a company will need to spend more time and money training them correctly as errors and mistakes occur. Standard operating procedures ensure that work gets done correctly the first time, as it costs money for businesses to have to continue to rework items. If projects or deadlines are on the line, businesses want to make sure that the work is completed correctly the first time. If your work is dependent on someone else completing their work, you want to make sure that you're doing everything correctly so you do not pause other people's progress. Standard operating procedures also ensure that your business stays compliant. In case there are ever issues that occur or your business is audited, you want to make sure your employees did not cut corners and followed protocol as instructed. If your employees are not completing tasks as required, your company could face penalties or fines, or worse, could be audited by creating standard operating procedures and enforcing your employees to use these correctly. As for the risks, along with the benefits, there comes risks. First, SOPs can be a source of misinformation. To prevent this, protocols should be user-friendly, clear, unambiguous, and must be written in plain language. Another risk is human error, as there can be a lack of knowledge, training, supervision, communication, or motivation. Human errors can lead to mistakes, accidents, needing rework, or waste. To prevent these errors, SOPs should be followed clearly, and any problems or deviations should be reported. Another risk of creating SOPs is if they are not updated when changes occur. This can lead to completing tasks incorrectly and can lead to needing rework, which costs time and money. Often people think that once the SOP is created that they are done with it, but processes change and the SOPs must reflect these updates to maintain accuracy. If employees do not follow the correct SOP template, this could make the SOP non-compliant with the business and could lead to audits as well. As for implementation, the most important part of this project was to get buy-in from leadership. I met with my mentor at the start of this course to discuss a project that would be effective in my role. My supervisor had already discussed the idea of SOPs, but nothing had been decided. My mentor and I decided that this project would be the best option because it is obtainable and is also a system that we should have in place already. Once we decided this would be a good option, my mentor met with the division administrator for our division. He offered his advice for the project, but ultimately decided that this would make both a capstone project and a valuable system for our division. Once I had support from both my supervisor and the division administrator, I created an SOP of my own to understand the process and learn how to create the SOP and how to stay compliant. I met with my mentor who already had a template from HR, and we discussed my first SOP and ways to improve. Since the start of the project, I have completed about 90% of my SOPs needed for my role. These have been discussed and approved by my mentor. For the timeline, I kicked the project off February 8th when I met with all parties involved to discuss the goals of the project and define the project. HR joined this meeting and discussed the proper template to use for compliance with company documents. I discussed the responsibilities and roles for each member of this project. I presented the project plan to the project members. The coordinators met on February 29th and provided their first drafts of the initial SOP they created. I collected the SOPs and reviewed them before meeting with the program managers for their input. I then met with the coordinators again just recently on March 13th to provide feedback on the SOPs that were submitted. Moving forward on March 20th, I will again meet with the coordinators to track the progress and collect any further SOPs created. Coordinators can ask questions they may have regarding the SOPs or any aspects of the project. The next few weeks after that will consist of emails to the coordinators to continue to see the progress made on the project. Coordinators should continue to submit completed SOPs and use email to express any concerns or questions with their progress. While the coordinators are creating the SOPs, I will create folders and subfolders on the division shared drive. I will also create the spreadsheet that tracks the list of SOPs and the spreadsheet that tracks changes made to the SOPs. All SOPs should be completed and sent to myself by June 5th. At this time, the shared drive should be organized and ready to house the SOPs. I will submit all SOPs to the correct program managers after reviewing them myself. Program managers and division administrators should approve the folders and SOPs by July 10th. At this time, the project will be complete. After the project completion, coordinators should be maintaining and updating current SOPs and should be creating new SOPs as new job tasks are assigned. Next, I will discuss the budget. The expense of the project will cost the company money regarding areas that are already being funded. The company will need to continue to provide upkeep with software maintenance and purchases. These SOPs will be created mainly on Word and stored on the company's shared drives. The Medical College of Wisconsin will also need to provide maintenance and purchasing of computer software to create the SOPs. While this is already an MCW expense would be providing, we must understand that this needs to be included in the project's budget. Currently, the project includes 3 employees that will be creating the SOPs, 2 program managers that will be approving the SOPs, the division administrator that will be the final approver, and 1 HR representative to provide the team members with guidance and company templates. It costs an estimated $150 to $300 per user per month to maintain IT services. Average cost based on the amount of time each employee will spend on this project, I estimate the IT maintenance and support of this project during the 6-month timeline will cost the company approximately $828. MCW will also need to dedicate a percentage of the above employee salaries towards the project. When all is said and done, I anticipate that the combined estimated cost of labor on this project among all members during the 6-month project timeline is $16,086, making a combined total of $17,914 for the project. Next, I will discuss the risks of the project. One risk to this project is employee dissatisfaction. Creating SOPs can be very time-consuming. Employees are not only asked to complete these tasks, but also create documents that show how to do the task they are expected to complete. Employees may feel stressed to meet deadlines with adding more tasks to their plates. Another risk is that employees may not feel the need to follow the SOPs once they are created. Another risk is if the SOPs are not completed correctly. This could lead to employees not completing the task correctly, which could lead to businesses being audited and fined. For the conclusion, I will start with the level of accomplishment. HR met with us to discuss the template of the company for creating the SOPs. At the end of the course, I have completed approximately 90% of my own SOPs. These SOPs have been approved by my supervisor and filed in the shared folder. Clinical program coordinators submitted their first round of SOPs, which I reviewed then submitted. After supervisors provided me with feedback, I met with the coordinators to discuss their first SOPs and provide feedback. Coordinators did have some questions regarding their SOPs and I addressed them as appropriate. We have been communicating via email regularly, and coordinators continue to submit their SOPs either via email or on the paper. The project was halted on the primary care side, however, because the coordinator for that section unfortunately left. I do have 3 SOPs from her and have filed those away. Since her departure, I have again seen the severe need for these SOPs, as my colleague and I are now tasked with covering her duties until a replacement is found. I have learned that the process of creating SOPs is timely but very important to the success of our division. I have dedicated a certain time block each week to create my SOPs and review my colleagues' SOPs while also now trying to complete tasks for our empty role and create SOPs for that role. As this process continues, I would like to see all roles in our division complete SOPs so that we are all able to complete tasks in case of absences. I also would like our coordinators to continue to monitor and update their created SOPs as processes change or new tasks are assigned. This slide is Appendix A, which shows the timeline chart. February 8th, I met with all parties to discuss the goals. February 15th, we identified team members and provided the timeline. February 29th, we met with coordinators. Final drafts of initial SOP will be due by each coordinator. I will collect and review before sharing with managers. March 13th, coordinators will meet with me. We'll provide feedback to other coordinators. March 20th is our next, and that's the meeting to discuss project, and coordinators should continue to submit SOPs. April 3rd is an email follow-up for project status. May 1st is the email follow-up for project status. June 5th is when all SOPs are due. July 10th is when deadline for managers and division administrators to approve SOPs. At this time, the project is considered complete. The future steps are to continue to update for changes in SOPs and create for new tasks. Appendix B shows the budget for the percentage of salary needed for each position. As you can see, per year it would be $34,172. Since this project duration is only 6 months, the total cost would be $17,086. The next slide for the budget shows the cost of IT. As you can see, for the whole year, the cost would be $1,656, but for the project duration, it would be $8,028. In Appendix D, I discuss the assessment of the project and the process. First, for mentor feedback. I found having a mentor during this project both helpful and needed. My mentor has been with MCW for over 20 years and is highly respected, and is also currently my supervisor. I've always felt comfortable going to her with any issues I have had in the workplace and know that I can trust her. When I first approached Jeanette about being my mentor for this project, she was excited and honored. We initially met to discuss the project, and she helped me develop both the project and the plan. Jeanette was an easy choice because a lot of her job responsibilities focus on quality improvement projects and data collection. We discussed the initial project and developed a timeline. She's been very active in my project and has offered advice along the way. I really struggled with the budget for the project, as I felt there wouldn't be any project since current employees would be creating these as part of their job duties. I received feedback from the instructor that all projects have a budget in some sense, and I brought this back to my mentor. She assisted with the breakdown on how to determine a budget, both for employees using part of their salary to focus on this, and for the tech support to assist with any issues. I do not think I could have completed this project without the mentorship from Jeanette. She continues to mentor me outside of this project, both with my career goals and promotion. Learning adjustments. During this project, I had some learning adjustments that I had to get used to. I have not been a leader in any sense before, so leading a project was an adjustment. I had to research and use lessons I learned from previous courses to learn how to become an effective leader. I then realized that my expectations needed to be realistic, as when I am tasked with something, I like to complete it as soon as possible. I needed to realize that a project is not an immediate solution, and there needs to be a plan. I found it difficult to find a middle ground between advancing the project and understanding that it is important to follow the timeline. The budget that I created dedicated a certain percentage of time commitment with each employee, and I needed to remember to adhere to that. As much as I wanted to have numerous SOPs completed each week to advance this project quickly, I needed to remember that time management was key in this success. Once I learned to allow the project the time it needed, I found it easier to manage the project and aid my employees. As for lessons learned, first would be in course BML 422, which is managing people and organizations. We discussed Maslow's hierarchy of needs. While I was starting this project, I thought back to the two-factor theory by Herzberg. In this theory, individuals were asked what satisfies them in the job and what dissatisfies them. Dissatisfaction factors were called hygiene, which included company policies, working conditions, safety, and security. The second factor is motivators, and these are satisfiers, such as recognition, achievement, advancement, and increased responsibilities. While I was creating the SOP project, I found that implementing these protocols would help employees succeed in their position. This would lead to less errors in their work, which could prevent loss of job and could lead to recognition of the employee if they continue to succeed. The next course would be servant leadership. In this course, we learned about the 7 pillars of servant leadership. The first pillar focused on being able to look at the big picture and identify key elements and processes. It also includes having the skill to identify areas of improvement. I identified the need for process improvement to fix problems we have with processes and became more cohesive as a group. Another pillar discussed was listening to employees, understanding their perspectives, and providing clear direction when needed. As I lead this project, I am reminded that I must listen to their concerns and offer feedback. The next course is BML 424, which is leading organizational change. In this course, we discuss Kotter's 8-step change model. We learn that steps include creating urgency, forming a powerful coalition, creating a vision for change, communicating the vision, removing obstacles, creating short-term wins, building on the change, and anchoring the changes in corporate culture. Each of these steps is useful when implementing a new procedure or protocol. In BML 423, which is strategic planning and implementation, we worked in a group to analyze a company and create a strategic plan. This course helped with my project because it taught me the fundamentals of how to implement a project. I learned about SWOT analysis and other measures of a business. In BML 323, Human Resources Management, we learned all aspects of HR management. I learned the importance of an orientation of an employee and how to incorporate a business's values and missions into every employee. To be a successful employee, you need to have proper tools to succeed, and this starts with onboarding. Appendix E focuses on my reflection. First, for recollections. Looking back at the course and the project, I found it difficult to manage this in the time frame. With it being an 8-week course, I'm used to fast-paced learning and assignments, but I found it difficult to complete this paper in 8 weeks when the project is set to last several months. I feel that since the project is still ongoing and the course is coming to an end, I'm going to need to make sure I dedicate that needed time to complete the project and make sure I am meeting deadlines. For reaction, I feel that having my mentor help me with this has been very helpful and made the project manageable. I stumbled when it came to certain aspects of the project, but having her there to guide me made the project feasible, and I knew I could make it happen with her support. For relevance, prior to this project, I questioned my leadership skills and genuinely thought that a leadership role would not be in my future. As this course comes to an end and the project is in its prime, I realize that I do have the skills to maintain a leadership role. I have also determined that I have an interest in continuing with project management and have asked my supervisor for more leadership roles in projects. Lastly, for responsibility, I have learned not only a lot about my own skills, but also the skills of my coworkers. Seeing them develop their standard operating procedures has made me realize that I am not responsible for making sure everything goes well, and that I can rely on others for help when coverage is needed. Since I've been in this department, I have avoided taking Wednesdays off because they are my busiest day and require extensive knowledge with hospital and patient structure. I did not trust my coworkers to complete these tasks correctly. Therefore, I made sure to be there every Wednesday. After watching my backup create her SOPs, I have learned that she is very diligent and competent in her job, and that I do not need to feel like she cannot handle my tasks. I have learned that I need to let others assist me, and this will ultimately make my work life more manageable. I have also learned that it is okay to ask for help, and it does not make me any less successful in my role. I have learned that I need to spend more time trusting others and less time stressing myself to complete everything alone. My last slide shows the references that I used for both this presentation and the project.